Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that have shaped the person who wears the white coat. I'm joined today with a distinguished doctor who's dedicated his life to healing. Thank you, Dr. Landman, for joining us.
Thank you, Christina. Thanks for having me.
So, what inspired you to go into medicine and then urology?
So I think that it was a fairly natural progression, although there were some branch points. My father was a urologist and probably one of the kindest people I've ever known. Even sitting at the table as a child, I remember big black beeper going off and hearing him chatting on the phone and ordering an IVP, which is now a defunct radiology test, and running into the hospital. And he was one of those old school docs who just cared about his patients deeply. And I deeply, deeply admired what he was doing because there was real passion there. You could tell. And as I went into med school and started my own residency, he would tell me, treat patients like family. So I received a lot of great advice from him and other mentors, but the best piece of advice I ever got was treat patients like family. And then on summer holidays and weekends, I got the privilege of working in the office, and I did everything from filing to developing x-rays, all sorts of stuff that we did back in the day. And mostly cherished the way he interacted with people. And he did treat people like family. And he did talk to people like they were family. And he gave them the right amount of time and empathy. And he was a great listener. So when it was my turn to decide what to do, I first wanted to be a vascular surgeon. I loved the technical challenge of it. It was fascinating and interesting. But then I rotated through urology, and I noticed this was at Columbia when I was in med school there, and the faculty had these incredible, charming personalities, and they were so engaged with their patients. And unlike some other surgical specialties, urologists do a lot of medical management and are a little bit more deeply involved in their patients' lives. No insult to other doctors. You're pretty cool too, just not as cool as urologists. So I think my personality fit with theirs, and with my father's teachings and background, ultimately became a urologist and really loved it. Still love it.
That's great. What interests or hobbies do you pursue that influence the work you do?
So again, I'll have to go back to my dad. So he was a urologist who spent an amazing amount of time working, but as a kid, it never felt like he wasn't there. And somehow he managed to be there for baseball games, for school plays, graduations, events, and I never felt like I was being left out for the work. And I think he's just an amazing person. So my life is modeled a little bit after that. So work a whole lot to be a really great physician. I think there's a lot of time and dedication, but you never want to sacrifice your family. And I'm very blessed to have a magnificent wife and two beautiful kids, and want to be there for them. So I think my hobbies are all based on what I can do with them. So I started gardening and growing a lot of my own food. Right now we have beautiful artichokes in the yard and avocados and herbs. Tomatoes are just starting this time of year. And that's right there at home, and sometimes the kids help, not often enough. And then I like cooking, and that became something that I could do at home. I'm sitting there in the kitchen with the kids, with Laura, and making healthy stuff. And then something clicked probably about a decade or just over a decade ago, where I started to realize that as a urologist, I was seeing more and more patients. So I specialize in kidney cancer and kidney stones, and the number of patients is growing every year. If you look at the SEER data, which is our national data, the curves are all rising from the 70s through now. And it's astounding that we're tolerating more and more of this. And it's clearly environmental exposures. It's air, water, food, all the things we're doing, our lifestyle. So then it became kind of this magical gestalt that came together of, wow, I really like being in the garden and growing my own stuff. I love healthy cooking. And now I can combine that passion at work being at home with the family and spending time with them in my free time. And now we've even built this magnificent men's health center with a teaching kitchen. And I'm going to drag my kids in there, kicking and screaming, of course. It's not going to be easy, but we'll make it happen. And so my hobbies are all around health and wellness, which I can bring to the family and I can bring to our patients right here.
What personal experiences have you gained in your work that have influenced your worldview or personal value?
Well, I think I've learned more from my patients than they've learned from me over the years. It's an amazing phenomenon when you listen to people. First of all, just the incredible bravery and strength that people bring. Because sadly, as a kidney cancer expert, even as a kidney stone expert, you bring people some bad news, and they go through some tough times. And fortunately, we're able to make them better. But seeing their resilience and strength has been inspiring. But I hear some of what originally I thought was incredibly strange feedback. And this started a long time ago. People started telling me, kidney cancer is the best thing that ever happened to me. And we take that very seriously. It sounds very odd, right? Because it's a horrible disease, and we fight so hard to make sure people have great outcomes. But many patients do. And what happens, because we chat about lifestyle thereafter to optimize their kidney function so that they'll have longevity, to optimize their overall health so they won't face another cancer or cardiovascular disease or anything else. We talk about diet and wellness and activity and sleep. And all of a sudden, people come back months and years after their surgery, and they look amazing, and they're fit, and they're lean, and they're happy, and they're energetic. And that's why I hear it's the best thing that ever happened to me. For many of our patients, it's a wake-up call. And I learned that in my own life. I want to prevent disease for myself, my family, and my patients more than I want to react to disease. So rather than being a reactive sick care doctor, I want to be a proactive health care doctor, caring about people's health. I think that's probably the greatest lesson I've learned.
What is most fulfilling and motivating about the work you do?
So it's the instant gratification of performing surgery and seeing people get better is extraordinary, and it feels so wonderful when you're able to take somebody who's really anxious and scared and help them through that and then see them thrive thereafter. As an academic urologist, so remember at UCI we have the discover, teach, and heal mantra. Discover is our research, teach is the education we do, and heal is the passion for taking great care of patients. But some of the most fulfilling moments are teaching people, medical students, residents, fellows, and seeing them evolve into great physicians, and then following their careers and seeing them do amazing research and great patient care. That is so meaningful, and it's extraordinary. And I feel like between my father and my mentors, Dr. Clayman, Dr. Benson, Dr. Droller, some of these greats, we're part of this amazing chain and family. So for me, most fulfilling, the great outcomes patients have, first and foremost, but also being part of this growing family of physicians and seeing some of our academic progeny truly thrive and bring huge value to the universe, that is amazing.
What do you believe are the most important technical and personal qualities for a successful urologist to possess?
So that's interesting. When you use the word technical, it implies kind of a technical skill set with your hands. I suffered terrible dyslexia, and coordination was not something I was great at. And I remember when I first went to do my fellowship and I was learning laparoscopic surgery, there were 20 people in the lab, and we would just practice on trainers, and I was probably the worst person in the room. So the most important characteristic is grit. I didn't like not being good, and so I literally would practice until my hands cramped every day, and then go back at night and do more and more, and then left where I was among the best in the room. So I think technical skill is not something you need to come in with. It's something that if you have the grit and tenacity to develop, you can develop it. And nowadays we're very fortunate. There's all sorts of simulators and trainers to allow people to develop the technical skills. What's most important is a real passion for taking care of people and a kindness. And we live in a world where we need a little bit more kindness, and I think we need to select the most kind, and they should become doctors. We'll all benefit from kindness, but when you're sick, when you have cancer or an infection or a functional problem, what you really need is somebody who's not just technically brilliant and cognitively brilliant, but somebody who really cares. And people feel that. They know when you care. And so if I had to instill the important things, grit and tenacity and a deep sense of caring, those would be the key criteria.
Well, so then how do you cultivate these important skills like effective communication and building of trust between your patients and their families?
Just sticking to that old mantra that my father taught me of treat people like their family. And if you go into a scenario thinking of somebody as if they're your sister or your parent, your grandparent, your child, and show them the same caring that you would your own family, they'll know it. And usually you end up doing the right thing. The world isn't perfect, and certainly physicians aren't perfect, and our technology is not perfect, but people know you care, and we do great work, and usually things turn out great. But the thing is showing people, and it has to be in a bona fide way, that you deeply care about them and their problem. And then this kind of great concept of shared decision making, where you listen very carefully, you tell people options, and you work together so that the individual's preferences, the way they see the world, is incorporated into the management strategy. I think that's really critical.
So, how do you address the hesitations and concerns that patients may have about seeking your care, especially for kidney cancer?
It's scary, and there are many different stages to engaging with a tough problem. Denial, of course, being the first one. But in the end, we all have to have the strength to address these challenging problems, and people do. And I always tell people, just do your homework, really figure out what great resources are available to you. And when you have a team that cares deeply and has massive experience, decades of experience, and it's not just the physician you're going to see, it's the physicians, the nurses, the technicians, the equipment, the hospital. It's a gestalt that you need to cure your problems. That's what people should be looking for, and I think just sharing with people the resources we have available here at UCI Urology helps people make a decision. And I'm very, very huge advocate. I'm a huge advocate of making sure people do check out other doctors, other locations, other venues, and they should decide which one best suits them. And the truth is, most people find our system to be pretty optimal, but we may not be for everyone. And I think it's just about making sure you do your homework. Knowledge is power when it comes to taking care of yourself, and you should just be very knowledgeable.
How are you involved with and preparing for all the changes that are coming to the field of urology?
That's a great question. If you had asked me the changes that would take place when I was a medical student or a resident or a fellow or junior faculty, I never would have imagined healthcare would be like it is today. So I think the one thing we do is teach people to learn. So we do it for our medical students and our residents, and we as faculty have to do the exact same thing. We have to be ready to learn. And a lot of things we're doing are much improved. And I think obviously some steps are not in the right direction, and over time those things get culled out. But being ready for change. And I would argue that, quite frankly, our team is engendering more change than we're reacting to. So our research literally changes the way we manage patients almost on an annual basis. We're doing a better job. And it sounds a little nutty, but I think our job as academic surgeons with a research crew that's extraordinary and resources that are extraordinary is to make ourselves look silly. I want the stuff I did for my patients a few years ago to be primitive compared to what I'm doing tomorrow. And we do that. We have lots of different management strategies. The way we do every surgery has changed. The way we help prevent kidney stones, for example, has changed, all because of our own research and that of our colleagues. So being ready for change, and more fun for me is engendering that change to be a source of innovation, and then disseminating that information to our students and the world beyond.
Well, your dedication to your patients and profession is truly inspiring. Thank you so much for taking the time to share your personal side We wish you all the best on your positive impacts on the world.
Oh, thank you for the opportunity.
Of course. Let us all take a moment to reflect on the values and principles that guide our own lives and the impact we can have on the world around us. Until next time, this has been a special interview on the personal side of medicine.